Hi, and welcome to the training video for sugar simulation used for global away rotation. This is the case overview. As a reminder, if you haven't watched the orientation to sugar, go to sugarprep.org and do that now. Let's get started. This is page 1 of a 2-page case handout. Let's take a look at the first section. This is the background you'll need to know for your case. The case we'll be using as a model is for diabetic ketoacidosis. The first section shows you the ideal emotional response during and after debriefing, the F's to the A. This section shows the supplies you'll need for the case. As a reminder, it's not necessary to have the actual medicines, just something that can be used in pantomime or acting, such as water in a syringe or Tic Tacs for pills. This section provides some useful tips for how to attain the emotional response. It's worth looking over before you start the case. Here you'll find the ideal medical objectives for the case. Note our goals for the DKA presentation are that the residents first identify DKA and then problem solve to treat using methods when they have limited resources. Now let's take a look at the ideal case flow. You'll have one of these for each of the cases. This gives you a 10,000-foot view of where the case should go. In this case, the patient initially presents with sign of DKA, improves slightly after some fluids. Note that we'll have to artificially elapse time once insulin is given to allow for the third and fourth state to occur where the patient becomes hypoglycemic and again improves after administration of glucose. Now don't worry if you've forgotten how to manage DKA. That's where this section, the key medical management reminders, come in. Here we'll provide useful information to review before leading a case to make sure you're on the same page with current recommendations and WHO guidelines. That's it for page 1. Now let's take a look at the second page of the case. The first section, found here, shows the key elements of a case presentation. We provide the basic background for how a patient would present with this condition, but leave it up to you as a clinician to provide the details. You can provide vital signs when asked and adjust accordingly. This section provides the paradigm which is the key to the success of sugar, particularly the expected intervention, obstacle, possible solution, and outcome. Your job as a facilitator will be to implement obstacles that mimic being in a resource-limited setting. This table provides examples for your specific case. For example, if a resident wants to check the patient's blood glucose, you may consider handing them the glucometer with just a few sticks left, or with instructions that are in Arabic, and allowing them to problem solve themselves and learn to ration accordingly. This last section tells you the stopping point for your case. You'll note it's less often about a strict medical stopping point and more often about allowing the learners an opportunity to encounter obstacles and work their way around them with limited resources. Remember, this paradigm is the key to making sugar successful and really mimicking that resource-limited setting. And that's all there is to it. You've learned what you need to know to start doing cases. Your next step will be to explore sugarprep.org, where you'll find further videos and more training on how to use the debriefing script, a key component to what makes sugar successful. Good luck!